Hi, my name is Dr. Amy Wasterlain. I am an orthopedic surgeon and joint replacement specialist. I wanted to thank you so much for joining me today. We'll be talking about overcoming joint pain and arthritis. So first, I thought I'd tell you a little bit about myself. I got my undergraduate degree from Princeton University and then went to Stanford for medical school. I moved back home to New York for my residency at NYU, and then did 1 extra year special training in hip and knee replacements at the Rothman Institute in Philadelphia. Things that are important to me professionally: I really love minimally invasive total knee and hip replacements. So I do a direct anterior hip replacement approach, which is considered minimally invasive. And I also do robotic partial knee replacements. And then my second passion is complex and revision or redo joint replacements. A little bit about me personally: I live in the Shoreline area with my husband, 2 kids, and dog. And I love to cycle, ski, hike, quilt, and dance. So I had a few things in mind today. I thought we'd start with talking about normal knee and hip anatomy. Then we'll define and talk about the diagnosis of arthritis. Then we'll talk about initial treatment options. And finally, I'll go over some surgical treatment options. So this is an image of a knee. The image that you see on the left shows the muscles of the knee. We have the tibia bone, which is the shin bone, the patella, which is the kneecap, and the femur, which is the thigh bone. On the right side, you can see those bones outlined and labeled a little bit more clearly. And there's some other important parts of the knee anatomy as well, such as the meniscus, which is basically a shock absorber. You have your anterior cruciate and posterior cruciate ligaments, also known as the ACL and PCL. You may have heard of famous athletes having an ACL injury. And then some other ligaments on the side of the knee, such as the medial collateral ligament and the lateral collateral ligament. So here you can see a more detailed view of the inside of the knee, focusing especially on those 2 shock absorbers, the medial and lateral meniscus. Now, I just wanted to show you what that looks like on X-ray. So on the left side, you have a healthy looking knee, and on the right side, you have an X-ray of that same healthy looking knee. And the thing that I see most importantly is a beautiful space between the thigh and shin bones. That means that this patient has no arthritis. Here are 3 more views of X-rays, also showing beautiful space between the femur and tibia bones on the left. And then on the right side, you can see the kneecap with beautiful space between the kneecap and the femur bone. Now let's talk about hip anatomy. It has a very similar concept. So here you can see the pelvis, and you can see the femur, which is the thigh bone, and the femoral head, which is basically a ball as part of the ball and socket joint. If you remember, we were talking about the meniscus being a shock absorber in the knee. Well, the labrum has a similar purpose in the hip. Here's an inside view of the hip joint, and I would focus most on that light purple area. So you have cartilage on the ball of the femur, and you have cartilage on the socket side as well. And that's critical to having a healthy and painless hip. Here we can translate the anatomy I just showed you in diagrams into a healthy pelvis and hip X-ray. So if you look here, you can see that ball and that socket with nice space between the 2 bones. And that means that the cartilage is still healthy and intact. So now that we've talked about normal hip and knee anatomy, let's talk about defining and diagnosing arthritis. So knee arthritis occurs when the cartilage between the 2 bones gets lost and damaged. So again, on the left side, you can see that healthy knee anatomy that we've seen before. And on the right side now, you can see damage to the cartilage. As the cartilage gets damaged, the space between the 2 bones gets narrower, and the patient starts to feel pain. Arthritis can go in many stages. It starts very mild, and as it progresses, you get more and more damage to the cartilage and more pain. How do you know if you have arthritis? So patients often report symptoms such as stiffness, oftentimes when getting up and down from a chair, things like knee or thigh pain. You may notice swelling in your knee. Sometimes patients feel like the knee is going to give out. They may also have pain walking, going up and down stairs, or kneeling. So here you can see the X-ray that we're familiar with of a normal knee on the left with the femur and the tibia, with nice space between those two bones. And unfortunately, the patient on the right side is now suffering from severe arthritis. You can see that the space between the two bones is very narrow, and in fact, this patient actually has bone-on-bone disease. And this is a knee that probably hurts quite a bit. If arthritis progresses even further, you can start to develop things like deformities. So for example, you may notice that you've become very bow-legged or potentially knock-kneed. This patient here, the x-rays are showing a lot of wear and tear on the inside of the knees, and they've developed a bow-legged deformity. Now that we've talked about knee arthritis, let's discuss hip arthritis. So the concept here is the same as with knee arthritis. Arthritis is a wear and tear of the cartilage that leads to decreased joint space and extra bone spurs. On the left, you can see the same image that you're familiar with, showing normal cartilage and normal anatomy of the hip. And on the right, the patient has started to develop a lot of wear and tear of the cartilage with decreased joint space and lots of extra bone spurs. This causes grinding and pain in the patient. Now that you understand the concept behind hip arthritis, how would we know if we actually had it as a patient? Some of the symptoms can be groin, buttock, thigh, and sometimes even knee pain. Patients have pain walking. Sometimes they have pain twisting, such as doing activities like golf when they have a golf swing and a twist. You may have pain going up and down stairs, getting in and out of a car. Sometimes patients even notice a difference in their leg lengths, or they'll start to notice a limp. On x-ray, you can see on the left side the normal hip joint with normal space between the socket and the ball. And on the right side, you can see very severe narrowing. The two bones almost look like they're touching. That's severe arthritis. Here's a more detailed view. You can again see what's labeled as osteosclerosis. That basically means thickening and hardening of the bone as a result of arthritis. You can also see big bone spurs, which are labeled as osteophytes, and the joint space narrowing that we've been talking about. Eventually, just like with knee arthritis, you can develop severe deformities and shortening. This patient here has arthritis of both hips. On the right side of the image, you can see the same kind of arthritis we've been talking about, with a lot of joint space narrowing and some bone spurs and some thickening of that bone. But on the left side of the image, it's even worse. You can see that that ball has started to collapse and the whole femur is starting to move upwards. This would actually lead to the leg being shorter. Now that we understand how to diagnose arthritis, let's talk about some of the treatment options. One of the first and most important things is physical therapy. Physical therapy does not cure arthritis, but it really can help to improve your biomechanics by teaching you to engage different muscle groups. With early arthritis, physical therapy can be very helpful. Another important step in the treatment plan is NSAIDs, which basically means anti-inflammatory medications. These are things like ibuprofen, naproxen, meloxicam, or you may be more familiar with the brand names such as Advil, Aleve, Motrin, Mobic, things like that. Tylenol actually is not an NSAID and does not help with inflammation, so it's usually a little bit less effective than ibuprofen. Another helpful conservative treatment option can be a brace. There are many different kinds of braces that you can get both in your local pharmacy and by prescription. The most useful is typically what's called an offloader brace, and it essentially applies a gentle force to your knee to try to reopen the space that was closed down due to the arthritis. Another option is to use a cane or walker. If you were going to use a cane, you should use it in the opposite hand of the side of your body that's affected, because this improves your gait and walking the most. When all of those other treatment options have failed, another option can be a cortisone shot. We typically inject cortisone along with a local numbing agent, like lidocaine, which is similar to what you get at the dentist before you have a cavity filled. This can be a really great option that provides excellent relief for a few months, often 3 months, or for some people even longer. Another injection that you may have heard of is gel or visco, also known as hyaluronic acid. Research shows an inconsistent efficacy, so in general, the orthopedic community recommends cortisone as more efficacious than gel. However, there are some patients where cortisone just doesn't work, and this is another option that we can try. Unfortunately, if you have failed all of the previously mentioned techniques, it may be time to consider surgery. Let's talk about that. One of the first and simplest types of procedures that you can have is an arthroscopic surgery. And this basically means that your surgeon will insert a small camera and one or two other devices to help them clean out your knee or your hip. This can help with things like mechanical symptoms. So if, for example, in your knee, you are getting clicking and locking and catching that's really preventing you from moving the knee smoothly, this can be an effective treatment to help clean up the knee on the inside. The key thing to remember is that unfortunately, arthroscopic surgery does not cure arthritis. So it can be really helpful in the early stages of disease, but it's not as helpful when arthritis has progressed. Another option is a partial knee replacement. This can be a great option for younger patients who have arthritis that's affecting just one part of the knee. It's great because it feels like a more natural knee. So even after having a partial knee replacement, it really may feel like it's your own knee. Another great thing about this is that it can be done as an outpatient, and we can use a robotic system to help us navigate and make sure that we get perfect alignment. Here is another type of partial knee replacement called a patellofemoral replacement. So instead of replacing part of the tibia and femur, this replaces the kneecap and gives the kneecap a really nice place to glide smoothly. For patients who have arthritis in the entire knee, you really won't benefit much from doing a partial knee replacement. And in these cases, I recommend a total knee replacement. This is a bigger surgery and typically requires a stay overnight, but is very effective in completely eliminating the arthritis. And the great thing about a total knee replacement is you do not need to worry about the arthritis coming back. It is gone forever. Similarly, there are total hip replacements. In a hip replacement, we resurface the socket and we give you a new ball with a plastic liner in between. This is a fantastic procedure that has been said to be as effective as open heart surgery in terms of improving quality of life. Patients recover fairly quickly and go home the next day. Here is a patient who has a pelvis x-ray, and you can see that the hip on the right side of your screen has a lot of narrowing. So this is severe arthritis. This was a real patient on whom I did a total hip replacement, and she was really thrilled with the result. Thank you so much for joining me today. I hope that helped explain a little bit about hip and knee arthritis and some treatment options. I hope you'll reach out with any questions or if I can help you in any way. I really hope to see you soon at the Connecticut Orthopaedic Institute at Midstate Medical Center. Thanks.